Once again, hi and Assalamu alaikum wa rahmatullah. This is TBYP, or Tips to Boost Your Knowledge in Pharmacology for medical students. And here I am again, Dr. Marwan with you. Tip number 2 is about the drugs. After finishing the tip number 1 about the pharmacology and the areas medical pharmacology and toxicology, here we are going to discuss a little bit about the tip about the drug definition. Originally, the drug came from a Greek name of the word pharmakon. And when we tried to search, Google search for the translation of the word pharmakon, we found that it is a medicine or a drug, which is originally Greek, as I said, or it's the old meaning also includes the meaning of a poison. This implies these two meanings implies that the risk of harmful effect of a drug can never be eliminated, because a drug can be beneficial and also with a disadvantageous effect. These are some few examples that I'm going to share with you about the drug being beneficial and also harmful, the pharmakon. Cyclophosphamide, for example, and methotrexate are anti-cancer drugs. Very beneficial, very strong, very potent cytotoxic agents for killing of cancer cells. At the same time, they are not free from the immunosuppressive effect on the bone marrow, rendering the patient under the high risk of infection, serious life-threatening infection. Example number 2, opioid analgesics such as meperidine and morphine, very high, very potent in dealing with post-operative analgesia for pain. The high level of pain, it can reduce it, a very potent analgesic effect, but with a potential of causing respiratory center depression and hypoventilation. Aspirin is the last example for this tip. And aspirin is widely used for, especially in high therapeutic doses, for the treatment of rheumatoid and osteoarthritis and joint pain in general. However, aspirin is not free from the disadvantage of causing peptic ulceration, gastric ulceration, and even perforation and bleeding. So the take-home message is that there is no drug without an undesirable side effect. That's why pharmakon can be a drug. Any drug can be a drug, beneficial effect, and also with a disadvantage effect or even sometimes toxic effects. Now this carries us to the question that does a drug means an addictive substance? Although it's common in layman term to use drug for addictive substances, but the answer for this question is no. Drugs are actually any chemical substances that can act on biological systems at the chemical or molecular level and can cause an alteration or modification in the biological function of the cells. Drugs also vary in size in their physical property, ranging based on molecular weight from 100 to 1000 Dalton as a general rule. However, some drugs are so small they can be as tiny as 7 Dalton, like the molecular weight of lithium, and this makes it easy to penetrate the cellular membrane, reaching wide areas in the organs of the body, and this leads to the fact that its action can be non-specific, causing multiple side effects. On the other hand, some drugs are extremely large molecules, such as thrombolytic enzymes used for the treatment of thrombosis, or to dissolve the preformed thrombus inside the blood vessels. This large molecular weight means that they are incapable of penetration through cellular membranes, so its volume of distribution will remain very low. And this will also mean that they are always available for elimination because of their high molecular weight, and they are always staying in the blood in the blood circulation. So they are often poorly absorbed and poorly distributed through the body. Um, uh, Now, the take-home message is that the size of the drug particle determines its penetration ability through the cellular membranes, and therefore this will also influence its volume of distribution. Whether the drug can have high or low volume of distribution, this can also in turn will influence the half-life of the drug, whether having long or short half-life based on the fact of its molecular size. So here we have lithium as a very small molecular weight molecule with a very high volume of distribution, non-specific action on multiple organs of the body because of low molecular weight, very high volume of distribution, and very long half-life. As compared to tissue plasminogen activator or alteplase, very large molecular mass, up to 50 kilodalton, up to 60 kilodalton actually, and this will lead to having a very low volume of distribution, which means it's confined to the blood, and that means also it will have a short half-life. So here you can see that lithium here is having a very high oral availability. These are pharmacokinetic parameters of different drugs. The example that we have here is for lithium as a small drug particle, very good oral absorption with a very high volume of distribution to the body. Very high volume of distribution because of the small particles, penetrates all cellular membranes, and therefore the half-life, the time that it stays in the body is also very high per each dose. So that was the end of the tip number 2. Thank you for listening, and see you again with another tips to boost your pharmacology, TBYP. Assalamu alaikum.